Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Genetics and genomics research has been conducted in Uganda for more than 20 years, and the volume of this research activity is expected to increase because of its potential to advance targeted disease detection and interventions to address significant burdens of communicable and non-communicable diseases in the country. However, genetics and genomics research presents unique challenges for ethical and regulatory oversight, especially in low-income countries such as Uganda. Professor Erisa Mwaka says they conducted a study to establish the gaps within. The focus was to find out how respondents react towards getting involved in research studies of this nature.
Okay, we've come up with this information. We've identified some of the gaps in our ethical regulatory frameworks, and we've made recommendations. Okay, that we need better guidelines. Okay, we need we need a deeper involvement of communities in this research, in these research-related activities.
He says an in-depth understanding of these ethical, legal, and social issues is essential to the process of developing meaningful ethics guidelines for genomics research.
We've already talked about the understanding. Then when it comes to the children, ideally, the permission has to be from the father and the mother. But you find that it's mainly the mothers who come to hospital. It's mainly the mothers, and at times the mothers are powerless. Actually, some mothers will tell you, you know what? Yes, for me I've accepted, but please make sure the father never knows. Okay? Then others will say, fine. If the father knows and something comes out, they'll blame me. That I'm the one who brought the bad genes.
Whereas this research is capable of defining the future of humankind, Professor Mwaka says the difficulty lies in when the targeted group for study has reservations on the outcomes.
So with genomics, actually, you can even find out that a child has a probability of developing a disease maybe at the age of 40, even at the age of 30. So the thing is, if you're a parent, would you like to receive information that your 3-year-old child, maybe at the age of 18, might be in a wheelchair? Some people will tell you, yes, I need this information because I need to prepare myself. Another one will tell you, no, I do not want to, to live in worry. Okay? Then others might say, fine. When they get to know this information, they'll say, after all, oyo mwana losi. Why don't we concentrate on these ones who have a brighter future and live? So there is an element of stigmatization and discrimination. Okay? And all these are ethical issues.
Regulation is key towards supporting research, but Professor Mwaka says Uganda needs to do more in formulating guidelines and laws governing such studies.
The UNCST, the UNCST Act of 1990, we have the National Drug Authority Act, we have the Uganda National Health Research Organization Act, we have the Data Protection and Privacy Act of 2019. There are so many laws, okay? But the problem is, many of these laws are not specifically research oriented. We need a specific law for research. Like you see in Zambia, in South Africa, Malawi, they have what they call the National Health Act, which National Health Act has a specific section for research. In Uganda, that's lacking.
And probably translate science to indigenous languages to ease collection of data.
You need to understand, and you can only understand when they give you enough information. But the problem is, many of our participants are not educated now. Like I asked in the room, there is a word we call genomics. Do we have any name for it in Uganda? Maybe not. Genetics. Do we have any name for it in Uganda? Maybe not. Everything is ndaga butonde.
Genetics and genomics research is the study of heredity and the variation of inherited characteristics, genetics, and the study of an organism's whole DNA set and its interaction with the environment, genomics. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.